were an early adopter of digital mammography at our facility. Our first unit was put in 2008, and we were coming up on time to replace that particular unit. We knew we wanted to go with 3D mammography. The issue was the cost, where we were looking at over $500,000 worth of equipment, how we were going to raise the funds, how we were going to implement new processes and techniques that we had never done before. So all those presented some early challenges to us. But we have a radiologist that was a breast imaging fellowship trained radiologist who really believed in 3D mammography and really pushed this project forward for us. 3D mammogram allows for about a 40% increase in smaller cancer detections. Stage 1 cancers are very easily treatable and curable. Nobody wants to hear that they have a diagnosis of cancer. But when it's caught early, the survival rate is very close to 100%. And the 3D mammogram creates 120 separate images of each breast. So the radiologist can go through section by section in each breast and find these little cancers that could potentially be hidden. And in our research, when we go back retrospectively, we felt that we picked up probably 25% more cancers than what we would have over a standard 2D mammogram. To alleviate the cost of the equipment, every year our foundation has a event called La Soirée. That particular year we raised over $40,000 towards the project and the campaign. We also had some other smaller donations that would come in and help along the way. We also wanted to ensure every woman got a 3D mammogram. When we looked at the numbers and statistics for our area, there was about a 40 to 60% compliance rate because other facilities were charging more for 3D mammogram, and we felt strongly that every woman should have it regardless of cost, which we had to go before administration, get the approval to do that, and tell them we're going to spend over $500,000 and not charge any extra for the 3D mammogram. But they were very supportive, and we were very lucky that they chose to get on board with our project. And we developed some best practices and revamped our total way that mammography is done in our facility. That's resulted in our patient surveys of anywhere from 95 to 100%, excellent rating for us from our patients. We had extremely high patient satisfaction rates. We allowed our radiologists and our technologists to spend time with the patient after doing biopsies, walking them through the next steps, talking with their provider, their physician, to get them up to speed on the patient's diagnosis. We decreased our turnaround times from with our lab from our biopsies to less than 24 hours. So we would do a biopsy, that patient had the results of that biopsy back within 24 hours. Before it was taking up to 5 to 7 days.